Hello, I am Dr. Prathiba Setti, practicing gastroenterologist at Bangalore. Today, I would like to discuss with you the most common topic of gastrointestinal problems, the gastritis. So, what is gastritis? Gastritis means there is an inflammation of your stomach wall. The reason for this may be many things. Most commonly, the reason is bad food habits leading to a stomach infection, which is the H. pylori infection. So, in this infection, the bacteria is ingested by the patient and it goes and settles down in the lower layers, inner layers of the stomach and increases the acid production in the stomach. So the patient develops symptoms of gastritis. So what are the symptoms of gastritis? Patient has burning sensation in the abdomen. Patient may have pain in the abdomen. He may have sometimes unable to eat or early satiety, what we call. As soon as he eats some food, he feels it's enough and my stomach is full. And sometimes he may have bloating and sometimes he may have anorexia, meaning he is unable to eat food. His appetite is lost. So, all these symptoms constitute gastritis. So, this gastritis is usually, sometimes it may be self limiting, what we say, as it usually lasts for some days or few weeks and it gets settled. But most of the time, this gastritis lasts for lifelong if we don't treat the patient. So, treating this patient is very important, and meantime, diagnosing this condition is also very important. The way we diagnose this gastritis is by doing endoscopy and a small test called rapid urease test, in which we take a small piece of the stomach lining and then test it for the infection H. pylori. So, if this test comes positive, then we have to treat this patients with H. pylori treatment. The treatment constitutes giving antibiotics and acid suppressants for a minimum of 2 weeks, and which may take around 2 months for the cure. So, depending upon the susceptibility of the antibiotics, the infection will get cured. And once the infection is cured, all the symptoms will revert back and patient will go back to normal. However, this infection may come back again with, again, I'm stressing on bad food habits, unhygienic food, and eating on all roadside items or any infected water and food. So, taking care of your food and your hygiene is very important despite treatment and also during the treatment. And all this gastritis definitely will be aggravated by eating very spicy food and coffee and tea. So, we need to be very careful, or we need to minimize eating spicy masala foods and also coffee and tea.